Insurance is all about an actuarial table. It's looking at the likelihood of you claiming against the company versus how much you're paying. What are some terms you need to know? One is the survival period. The second thing is pre-existing illnesses. Then the next one is about network hospitals, waiting period. The next is a copayment, your room class, disease sublimits. So today what we're going to look at is what is insurance? How does it work? And the bottom line is, what are the key terms that you have to be aware of when you're buying an insurance policy?
Hey guys, Dr. Nene here. I practice as a cardiothoracic, vascular, and general surgeon, and I'm now a health tech innovator who wants to improve lifespans and lifestyles. So stay healthy, stay curious, and keep watching.
Welcome back to the channel. In my career as a surgeon, the only thing I was responsible for was taking care of my patients. My back office did everything else. But someone had to pay the bills with regard to the patients, and that in the US was health insurance. As of 2012 and onwards, the Affordable Care Act mandated that people needed to buy health care insurance so that we would not have exorbitant bills going out of control. And the truth is, in the US, after the pandemic, 18% of the gross domestic product in the US is deputed to healthcare. Now, compare that to India, where it's 4% of the GDP, but more importantly, oftentimes 2/3 of that is private pay and 1/3 is public pay. What I know from my career is that if you get sick, and that's what insurance is about, an actuarial table which looks at the likelihood of you actually making a claim, and that's what keeps the insurance company in business by having low claim payouts. But if you get sick, it can lead to financial catastrophe. So today what we're going to look at is what is insurance? How does it work? And the bottom line is, what are the key terms that you have to be aware of when you're buying an insurance policy? I'm not going to get into the details of public health because I think that's well documented in various different surveys. And what I'm going to instead do is try to help you kind of navigate what insurance is like, both globally and in India. All right? So let's get to it. Why do you need insurance? It protects you against unexpected medical expenses, and it takes the stress out of this situation. In many cases, it's a cashless policy, so your hospitals that you go to, you don't have to pay anything for, and the insurance takes care of everything. The second part of that equation is it allows you to see the best-in-class doctors and go to the best hospitals without worry. And then lastly, it kind of gives you peace of mind knowing that you're covered if something unexpected happens. This can help you focus on recovery and well-being rather than worrying about how you're going to pay your medical expenses. So what are the things you worry about? Well, first of all, in India in particular, most insurance is inpatient only. So as you probably know, most people do most of their stuff outpatient. Any blood draws, any other stuff, very little of that is covered. It has to be for catastrophic stuff. But now insurance offers things for catastrophic problems and for critical illnesses, accidents, child and mothers, and senior citizens in some cases, although it does deny insurance to many people over a certain age, 75 to 80 in general. It can be a tax savings in some cases because the premiums can be deducted, but you'll have to check with your accountant on that because I can't clarify fully about that. What are some terms you need to know? I found some very interesting ones. One is the survival period. It means that in a catastrophic illness, in the critical illness plans, you have to be alive for at least 30 days after being diagnosed with the medical condition to get the claims benefit. This one makes no sense to me. So if it's in there, you better have a red flag and ask your insurance agent. The second thing is pre-existing illnesses. Well, look, insurance doesn't want you to buy it so you can get your hernia fixed, which you've known about for 10 years. So what they'll do is they'll have a gap of a number of years so that they're paying off their claims, and it can be up to 4 years in many cases and less in other cases. But you have to check there and make sure that whatever you need, whether it's kidney stones, hernias, all of this stuff, if it happens after you get your insurance, is covered. Then the next one is about network hospitals. Some have cashless, some don't, but you have to check what tie-ups are there and which ones you need to do. Waiting period. This is an interesting one. How long do you have to wait before you can use your insurance? Sometimes there's a period, a gap between the time you subscribe to the time you can actually use it, and it can be up to 30 days. So you don't want to be left uncovered. Now that makes no sense. If you've already paid your bills, why should there be a waiting period? The next is a copayment. This clause basically says that a portion of the overall you'll have to pay. And what you have to judge is that for a no copay policy, you may have to pay a higher premium. So you have to figure out where it is cost to benefit. The next is your room class. And it's very interesting. Make sure you read the fine details here. Avoid a policy with room rent limits if you can, or take one with a good limit so that you don't end up being in the general ward or somewhere you don't want to be, or if that's okay with you, then you know about it. Disease sublimits. You might get lower premiums, cost of sublimits on certain diseases, and you got to make sure that that doesn't apply to you. As you get older, some of these diseases will pertain, and you'll end up paying more. No claims bonuses are always good for this or auto, and they can give you a substantial bonus if you're not claiming anything on your insurance. And so if you renew year after year after year, it's not a problem. Finally, the main thing with insurance is you have to figure out in your own head if you need it. In my book, some amount of cover is required, and this is something everyone asks me, that how much cover do you need? And I think nowadays, if you are of the age above 50, things can pile up with heart disease, diabetes, and other factors, and they'll factor that into the insurance policy. But I think that when you go to buy it, what you'll see is that for the amount of money you put into your insurance policy over time, it'll be far less than if you have a catastrophic illness and get inpatient treatment. Now remember, in most cases, they don't cover much outpatient work, and most of us will be doing our outpatient thing. In summary, make sure you read the fine details. I would say some type of insurance is required, and it should cover the hospitals and the room rates where you want to go to. Make sure you check on all of the nitty-gritties in terms of the coverage, the exclusion period, the catastrophic stuff they don't cover, and also check on the survival interval if there's any, because that one to me is a non-starter. Ultimately, and not to be negative about this, insurance is all about an actuarial table. It's looking at the likelihood of you claiming against the company versus how much you're paying. And that's going to be based on your particular variables and your particular past medical history, your age, and your other factors. And the more things that stack up, the more they're going to charge you. That's okay, because if you have one catastrophic illness, you'll find that that insurance will cover your backside and you will be much better off for it. So that's a little bit about insurance in India. Globally, in the US, it's mandated. A lot of it's offered by the employers these days, as it is in India. And the other thing is you have to look out for what it covers, what it doesn't cover. In the US, they have all of these different types of organizations, a health maintenance organization versus a PPO versus an individual physician. And each of these are covered in different tenses. And I think you have to go down to the nitty-gritties to see what coverage you have and what it costs, but it can be very expensive. In India, interestingly, it only constitutes about 10% of the population for private insurance, but that's going up. And the interesting part is public insurance in the way of public facilities are there, which will cover you at a basic level. But if you want to have a better choice of which physicians and hospitals and a cashless policy and more peace of mind, my advice would be to get an insurance policy. Look at the details we've talked about, and we'll put them on the screen as soups, and you will be able to know exactly what things to look for in your insurance policy. Plus, we'll leave the links in the description of what things are critical. Some of these are from insurance companies, so you got to take them with a grain of salt, but some of them are from reputed third parties which talk about it. And so I hope this helps you, because I can tell you from my family as well as yours, insurance is an important thing. You just have to pick and choose where to put it. Appreciate you listening in, and as always, if you like what we say, hit the like button, subscribe to the channel, and share this with everyone you know. And also hit the bell icon so that you'll know when the next time we publish something, you'll have first dibs on it. Thanks for joining us, and we'll look forward to seeing you in the next episode.